Today I am going to speak about the newborn care week. Newborn period is the period which refers to from birth to the first 28 days of a newborn baby's life. In India, we celebrate this week from November 15th to the November 21st every year. This is celebrated to create awareness to people about safe pregnancy, safe delivery and safe newborn care. To give a perspective to you, let us look at some of the data. In the world, about 2.6 million deaths, which is 26 lakh babies, have died in the first 4 weeks of life. To add to that, another 26 lakh stillbirths are there, which means about 5 million or a little more than 5 million babies are dying in the first month of life, and some of them are not even born. When we take Indian data, the most recent census shows that there have been 0.75 million deaths, which is 7.5 lakh deaths per year. If we look at the neonatal mortality rate, the figures we have is from 2013. In 2000, the deaths were about 44 per thousand live births. This has significantly reduced to 28 per thousand live births. However, this itself is quite huge. If you were to compare a small country like Japan, where the deaths is 2 or less than 2 neonatal deaths per thousand live births. So with this, we know that India has a long way to go. So what are the causes of these deaths? One is premature babies, complications during birth, and infections in the newborn period. These are the major killers. Apart from this, congenital anomalies or birth defects also contribute to almost 10% of all the deaths. If you look at the deaths, more than 75% of these are preventable if timely action and proper care has been provided to the mother and to the newborn baby. So if these deaths are preventable and are prevented, neonatal mortality rate can fall to less than 10 per thousand, and this is one of the goals of India set itself to in 2035. So this week we need to spread awareness to the people about proper antenatal care, which is women who are pregnant should avail a doctor or a midwife's facilities at the earliest, get themselves checked, make sure they are on proper nutrition and proper diet, take iron and folic acid supplements, ensure if thyroid or gestational diabetes is there, they are consulted with a physician and have taken good care, having a safe delivery. We should avoid all deliveries at home and request all the mothers out there to deliver in a authorized primary healthcare center or a district hospital or a private hospital, but not at home. Immediately post birth, skin to skin contact of the baby to ensure that baby's temperature is maintained is vital. Early initiation of breastfeeding and exclusive breastfeeding for 6 months is vital, and all the practitioners out there should ensure that a dose of vitamin K is given to the babies to prevent vitamin K deficiency related bleeding complications in the children. Also, before the babies are discharged, newborn vaccines such as polio, hepatitis and BCG should be given to all the babies born in India. So, medical practitioners, nurses, private practitioners, government setup and the government officials who are working should work hand in hand to ensure that our neonatal mortality rate in India falls to single digit numbers in the next decade.